Follow me because by the end of this video, you'll wonder how you spent all this time without knowing this important information. Heart is dying. 12 weird signs of heart damage. Moo, doctor explains. You might think heart problems come with obvious signs like chest pain or shortness of breath. But what if I told you your body has been trying to warn you in the strangest ways, and you just didn't notice? Your heart is the hardest working organ, pumping about 100,000 times a day without a break. Yet, when it starts struggling, it doesn't always scream for help. Instead, it whispers in ways you'd never expect. Today, we're uncovering 12 bizarre signs that your heart might be in trouble, and some of them are so strange that you might have brushed them off as nothing. But trust me, ignoring these signals could be a huge mistake. Let's start with something truly unexpected: swollen feet and ankles. Sure, you might blame it on sitting too long or eating too much salt, but persistent swelling can mean your heart isn't pumping efficiently. When the heart struggles, fluid builds up in the extremities. Studies show that 50% of people with chronic heart failure experience swelling before getting diagnosed. So, if your socks leave deep marks on your ankles, it might be time to check your heart. Next up, bad breath. Yes, really. Gum disease and bad breath aren't just dental issues. They're linked to heart disease. Research from the American Heart Association found that people with periodontal disease are twice as likely to have heart problems. The bacteria in your mouth can enter your bloodstream, causing inflammation that affects your arteries. So, if your breath smells like something died in your mouth, it could be your heart waving a red flag. Moving on, do you wake up in the middle of the night gasping for air? That could be a sign of sleep apnea, a condition strongly linked to heart disease. People with untreated sleep apnea are at a 140% higher risk of developing heart failure. Your heart depends on steady oxygen flow, and frequent disruptions can strain it over time. Let's talk about something even weirder: ear creases. Yes, a diagonal crease on your earlobe, known as Frank's sign, has been linked to an increased risk of coronary artery disease. A study published in the New England Journal of Medicine found that people with these creases had a higher chance of clogged arteries. So, the next time you look in the mirror, check your earlobes. They might be telling you something. Ever feel dizzy when standing up? If your blood pressure drops suddenly when you stand, your heart might be struggling to pump blood efficiently. A study from the American Heart Association found that people with this condition, known as orthostatic hypotension, have a 54% higher risk of developing heart disease. Do you get frequent shoulder pain? This isn't just a sign of bad posture or overuse. Research suggests that chronic shoulder pain could be linked to poor circulation and even heart disease. In fact, a study in the Journal of Occupational Medicine found that people with shoulder problems were more likely to have heart issues. Moving on to something you might never expect: blue or purple lips and fingertips. If your body isn't getting enough oxygen-rich blood, your extremities can change color. This could be a sign of heart failure or poor circulation. Don't ignore it. Get checked. Ever feel excessively tired, even after a good night's sleep? Persistent fatigue could mean your heart isn't pumping blood effectively. A study published in the journal Circulation found that 70% of heart failure patients reported extreme fatigue before their diagnosis. If you're tired all the time without a clear reason, your heart might be struggling. Let's talk about sweating. Sudden and excessive sweating, especially when you're not exerting yourself, could be an early warning sign of a heart attack. This happens because your heart is working overtime to pump blood through narrowed arteries. Don't brush it off, especially if it's paired with nausea or dizziness. Now, this one is really unexpected: your nails. Clubbed or thickened nails can be a sign of low oxygen levels in your blood, which might indicate a heart problem. A study from the Mayo Clinic found that people with heart disease often develop changes in their nails long before getting diagnosed. Next, do you get leg cramps at night? These could indicate peripheral artery disease, where narrowed arteries reduce blood flow to your legs. Studies show that people with frequent leg cramps are at a significantly higher risk of developing heart disease. Finally, let's talk about mood swings. Feeling unusually anxious, depressed, or irritable? Your heart and brain are deeply connected. Research from Harvard Medical School found that people with depression have a 64% higher risk of heart disease. Stress and anxiety increase inflammation, which can damage arteries over time.